Hi, Catherine. It's great to see you today. Thank you for joining me. I wonder if we could start just with some introductions. Could you tell us a little bit about who you are and
Yeah,
what you do?
yeah. Hi, Emma. My name is Dr. Catherine Hennessy. I'm not a medical doctor. I did a PhD. So my background is, well, first of all, I did a degree in sports rehabilitation and then got into anatomy. So I'm now an anatomy lecturer. I've been lecturing anatomy for 10 years, 11 years, sorry, actually, 11 years in the UK. And I recently became head of anatomy at Brighton and Sussex Medical School. So that's who I am. And my PhD was about social media professionalism, which kind of led me into this area of kind of research.
Interesting, thank you. So can you tell us a little bit more about your research interests and also maybe what drew you to that?
Yeah, so because I know you're probably thinking, okay, you're an anatomy lecturer, why are you interested in social media research? Um, So I think so as I said, I've been an anatomy lecturer for like 11 years. And when I first started um on my kind of lecturing journey, social media was becoming quite there was kind of an uprising, I think, in using social media as an educational tool to basically engage with students more. So I remember I attended a meeting with a chemistry lecturer. He was giving a kind of a seminar on how he was using Twitter to engage with his students, and it was really, really popular. So I decided I'd like to do a similar thing. So um, me and a colleague used a Twitter hashtag to basically support neuroanatomy course we were running with year 2 medical students at the time. And we wrote an article on it actually, and it turned out to be a very topical, um, um, like a very topical discussion point, I think, at the time, because using Twitter as an educational tool was a very new thing. This was probably, 2013, 2014. So yeah, I'd say about 10 years ago. So quite new. There was a lot of skepticism around it because people were thinking social media is kind of like what you use in your personal life and everything. But it was really I think it helped the students quite a lot, particularly with the topic of neuroanatomy, which can be seen as a very daunting topic, a very content heavy and complex content sort of subject. And even though I don't think we really noticed that it improved their ability to learn the topic, to learn the content, it certainly seemed to help with just supporting the learning. So a real kind of community was created by the Twitter hashtag amongst the students, and kind of mechanisms for helping them get through the course. So that's what we wrote about. And so, yeah, I started using social media in this kind of more professional capacity as a lecturer, and as an educator. And then that kind of developed into me um, continuing on that route of kind of exploring how social media can be used as an educational tool, but at the same time, how medical students start to use it in more of a kind of a professional capacity. And at the time, I was kind of in that area myself, where I had been always using social media previous to that from my personal life. And I'm of the generation where we would have been using like Facebook more so than like TikTok and Snapchat and everything that's now kind of more current. I was more of the Facebook era. Um, and at the time, never gave a second thought to anything that I was posting and the impact and the footprint that would have for future generations. I think maybe I was a bit naive at the time, but I definitely don't remember any education around it. And I think nowadays people are a lot more savvy. But I was kind of going through this journey of using social media previously in my personal life, now suddenly using it in an educational slash professional capacity. And I could kind of see that the medical students were also facing the same thing. Um, so it's a long way of saying I think that's what drew me to this area of research, is that I became very interested in how, because I was around basically medical students and anatomists, I was very interested in how medical students, particularly as young people, were kind of figuring out how to use social media in more of a professional way, and how to start to develop the concept of social media professionalism. So that's my area of interest. My areas of interest are social media professionalism and how medical students and doctors and anatomists and anatomy educators, they're kind of a few groups of people, but also like healthcare professionals generally, I think how those people are using social media professionally.
It sort of occurred to me as you were talking. I guess over time things are changing, and that's quite interesting because you mentioned that your original kind of interest was maybe 2013, 2014, is that right? And it was mostly
Yeah,
Facebook, but things have moved on. Has
yeah.
your interest also kind of moved into other channels apart from Twitter and Facebook?
Yeah, kind of well, I haven't really, so I started to use um more Instagram after Twitter as a way of kind of engaging students. But then quite quickly my interest just became more broad across the platforms about how how students and medical professionals are using the all of the platforms really, um, in more of a professional capacity. But I think probably people choose a certain channel or choose a certain platform that they're going to use in a professional way, and maybe stick to that. And obviously, there's going to be some people who would use various different ones, possibly if they're really into social media and probably have a quite a wide audience. Um, they probably would explore more of them, but I haven't actually gone much further than Twitter and Instagram myself.
Great, thank you. Um, and just thinking about the impact of the research that you've
Mm.
done, what do you think that might be, or have you seen any impact as a result of the research?
It's really great to hear that the review of the social media guidelines article that I wrote was of interest and was quite popular amongst NHS workers. Um, because I suppose you never know if how these things are used and whether anyone is reading them. I suppose you can get some metrics, but it's never, you don't always hear back on how they've been used. But yeah, so just to talk about, so that was obviously a review of guidelines that are available on social media use. Um, and basically to summarize the article, um, what I found was that the majority of the guidelines are quite focused on the risks of using social media as a professional within the healthcare world. And that's what I see as well from my PhD research, which this article was part of. Generally, I found either if you're a medical student or you're a junior, middle, or senior doctor, there's a wariness of using social media as a professional. And I can see why that would be, particularly if the guidelines are kind of predominantly saying about or mentioning the risks as opposed to encouraging you on how to do and how to use it. Um, so the impact that I would like my research to have would be to empower or educate medical professionals healthcare professionals, not just medical, to be able to use social media in a professional capacity and be able to experiment at least with it. Because I think the current guidelines maybe deter people from using it at all. Um, because there's this conflict because at the same time there's this, kind of e-health um, surge kind of or encouragement happening from the other side where, and a lot of patients are online. There's a term called e-patients, very people who are very e-literate, I guess, getting lots of information from technology, online sources and social media sources, and gaining a lot of information from those sources and becoming quite informed about their, their illness or whatever. And they're calling for more involvement from healthcare professionals. Um, so there's kind of a bit of a conflict, I think, of what's what's wanted and what's not, maybe not needed. It's probably not 100% needed, but it's a shame that healthcare professionals probably don't feel completely empowered to engage in that way. So I would like the impact of my research is to help and maybe empower people to use it more professionally and feel confident to do that. Um, yes, I mean, I would also like to just maybe say that there's so that the article that I was just talking about was one part of my PhD. Another part of the PhD was finding yeah, I just wanted to mention that the PhD data that I gathered revealed that WhatsApp particularly, even though I guess lots of people wouldn't consider WhatsApp as a social media, but it is considered a social media platform. Obviously it's like a messaging platform, but you can share, lots of imaging content on there, lots of links. So it does fall under social media. And my PhD data, which basically I forgot to say that what I did for my PhD was I did several rounds of interviews and questionnaires on kind of medical students throughout their medical student journey. And then junior doctors, kind of middle range doctors and consultant level doctors. And once you kind of got to like the junior doctor to middle doctor, even consultant level, those groups, it was really, really clear that WhatsApp is used very widely within clinical teams, especially seem to be on hospital wards where there's a team working together. And so WhatsApp seems to be widely used for day-to-day working life, but including managing patient care. And yeah, that was like a really high percentage of doctors were telling me this. And obviously it seems to be doing great. It helps profoundly, I think. But I kind of got the feeling that, well, I didn't get the feeling. I mean, the data was telling me that, especially if you're a junior doctor, there's this kind of transition period where you're trying to get used to the fact that you're using WhatsApp in that way. And seeing how everyone is using it, and that's how everyone uses it. So you kind of follow along with that. But you might be in a situation where you're in a WhatsApp group and there might be an image of like some test results or something with some sort of anonymized way of deleting patient details. But not always. I think there was some people who said that isn't always the case. So that data hasn't actually been published yet because I went on maternity leave and didn't get to publish that side. But I would love to try and publish that data and highlight that this is an area of practice. I don't think it should be hidden because it seems to be so widespread and doing really good things. And so that's just when you're talking about impact, probably another area that I would like to try and work on is helping clinical teams to be able to use WhatsApp in line with kind of professional standards. Yes, because obviously when I was hearing the data at the time, it wasn't what I was expecting. But I think it seems to be that the weighing up of it doing good versus the risks or causing harm seem to be outweighed. And because there's a kind of a majority approach to how it's being used, also that seems to be kind of outweighing the kind of going against that process, if that makes sense. Um, so I would, yeah, I would like to help clinical teams do that. It seemed to be coming to be almost like the new pager system as well, to kind of alert people to come places and that kind of thing, and seem to be a lot more efficient at doing that job. Um, so yeah, so that's another kind of area of impact that I would like to have. Not quite there yet, but working towards.
Fascinating. Do you
Mm.
think that that will be a future research project or output?
Yeah, I would like to do that. As I said, I did collect some data during my PhD. That was from 2020, roughly. And bear in mind that was around the time of COVID as well. So um
Could be quite specific to circumstance.
yes, yeah. Um so it would be actually, I think it would be worth possibly doing more of a current data collection set, see if it's still being used in that way. And to just explore, like, probably maybe kind of um, ways in which medical teams or clinical teams are trying to ensure professionalism standards are used or kind of maintained while they're using WhatsApp. Um, because I did ask at the time during the research, because at the time there was an app available, I think NHS approved. The name of it I can't think of, but like a messaging app specifically for the purpose. Um, and where I'm based is in Brighton, Sussex, and it was advertised, this app, in the hospitals at the time. But the take up of it just wasn't. It didn't. It didn't take off. I think probably because people were already using WhatsApp, and it was like they knew how to do it, and it was just kind of easy. Um, so, and I think, yeah, there's this trend of kind of following what everyone else is doing. Um, and when I ask, or when I tell kind of the medical students about that, this is possibly something you're going to face when you get into, fifth year or in foundation year one, they do feel quite uncomfortable about it. Um, um, but yeah, and I will have to face it eventually. Um, But then I think when you're in it, you just kind of go along with what's being done, especially if you're seeing senior colleagues
Yeah.
doing it that way as well. So I think it's just an interesting practice, and something I think that should be talked about maybe a bit more to help those clinical teams on how to manage it, because they're clearly using it because there's a need. Kind of, it helps, I think. Um, so yeah, obviously then there's the flip side of it, where you're continuously getting WhatsApp messages when you're not on shift, which was another thing that came out of the
Or
research.
you're having to catch up with the 27
Yeah,
messages. Yeah.
yes, or you're off and you don't need to probably know about all that stuff when you're not on shift, but you're still being reminded of work, kind of like a WhatsApp fatigue.
Yeah.
Um, and again, bear in mind it was during COVID, so there was probably quite a lot of fatigue anyway. But I think lots of people, you wouldn't even have to be in a clinical team to feel probably a bit fatigued by WhatsApp work groups, because you're just very contactable nearly all of the time.
Yeah.
Um, so that's another potential future area to look into, like, benefits of social media versus um the challenges. And I think social media fatigue is already like a phenomenon that's been talked about quite a bit. But specifically WhatsApp fatigue, I think, is probably getting a bit. I think it's really mounting, especially in those work groups.
Yes, certainly.
Mm.
And is there any other research area or any other work that you're doing that we can look forward to in the coming months?
But we are trying to do more research into the nerve supply to the cervix and mapping out the nerves that go to the cervix and trying to create a model using a new technique where you basically retain nerves and you can dissolve the muscles around there. So a very different kind of strand, but we're going to be trying to work on that as well.
Great, that's really interesting. Thank you, Catherine. Thank you so much for your time today. And I
Oh,
think we'll finish there. Thank you for joining me.
thank you for having me. Thank you very much.